Hey, so we're going to be talking about the appendicular skeleton today. We're going to discuss the bones of the pectoral and the pelvic girdles. We're going to describe the bones of the upper limbs, including the bones of the arm, the forearm, the wrist, and the hand. We're going to identify the features of the pelvis and explain how these can differ between the adult male and female pelvis. We're going to describe the bones of the lower limbs, including the bones of the thigh, the leg, the ankle, and the foot. We're going to describe the embryonic formation and the growth of the limbs. So remember that appendicular skeleton is all of the appendages that come off of the axial skeleton. So we have the scapula, the clavicle, the humerus, the ulna and the radius, as well as the carpals, the metacarpals, and the phalanges for the upper appendicular skeleton. And then for the lower appendicular skeleton, we have the pelvic girdle, we have the femur, the patella, the tibia, the fibula, the tarsals, metatarsals, and the phalanges. So that pectoral girdle is going to be everything that sort of comes together to form your shoulder, right? So we have that clavicle, we have the scapula, and we have the glenohumeral joint right here. Okay. The clavicle that sits right here, you might have heard it called your collarbone, is the most fractured bone within the body. For females, it tends to be shorter, thinner, and less curved, and for males, it's longer and heavier, and it has a greater curvature. And there's also some rougher surfaces where those muscles attach. When we talked about bone remodeling, we talked about how this is more pronounced in manual workers because we have all of these ligaments actually pulling. Okay, so we have the corticoclavicular ligament right here and the costoclavicular ligament. Costo means rib, so that's where that comes from. And then the coraco, it comes from the coracoid process, which is right up there. Okay. So here you go. There's that coracoid process that I was talking about. This is the scapula showing you the pectoral girdle. And so we have the clavicle and the scapula forming that pectoral girdle. And here is the acromion. If you reach sort of back behind you onto your shoulder blade, the shoulder blade itself is actually the spine of the scapula right here. And so this is the right scapula on the back. So when you reach back, that's what you're feeling. This would be towards the front of your body, towards your chest. Okay, and so when we look at it from, this is our right scapula, okay, so this is how it would fit in our body. We would sit it right here. Okay, this is the lateral border to the outside, and then you have the medial border towards the inside. Okay. Now again, that's the spine right there. So above the spine, you have what's called the supraspinous fossa. Supra means for superior, spinous, right there. So above the spine, and then it's a fossa because it's got a little groove to it. Okay. Below the spine, you have the infraspinous fossa. That's for inferior. Okay. And then on the front surface, you have the subscapular fossa, subscapular, right there. Okay. Now, this is that coracoid process where the corticoclavicular ligament is going to attach in. And they form right here, we have the acromion, and then that's going to form what's called the glenoid cavity, and that's where the head of the humerus is going to fit in there. So here is the humerus and the elbow joint, and so you can see there that is the head of the humerus, and so it would fit right into that glenoid cavity that was found. On the humerus, you have what's called the deltoid tuberosity, and the deltoid tuberosity is where your shoulder muscle, your deltoid, actually attaches on and sort of helps to get that sort of raising motion. This is down in the elbow, so this is the inside of your elbow, and then here, the posterior view is the outside of your elbow, so that pointy part. Okay. And so on the inside of your elbow, okay, you have the capitulum and the trochlea, and they are both on your humerus. Okay. And then on the other side, you have the olecranon, and the olecranon is part of your ulna, right? And that forms sort of that pointy part of your elbow that you can feel. The olecranon fits into the olecranon fossa. These are the radius and the ulna. Right? The radius and the ulna are attached together through an interosseous membrane. Right? And when you hold your hand with palms to the sky, okay, supine, then you will have your ulna here and your radius over here at your thumb side. When you flip them around to pronate, okay, they're actually going to cross over one another, and that's because the head of the fossa, or sorry, the head of the wrist is going to sit into this radial notch on the ulna, and it allows it to sort of twist, sort of like, what do I have that I can use? Hold on. There's a cap down here. So it sort of sits in and it's able to spin like that. Okay? And then towards the wrist, you have the styloid processes. You have one on the ulna and you have one on the radius. Okay? And they form sort of these fun bony protrusions coming off right there. Okay? So for the wrist and the hand, we have all of these carpals, metacarpals, and the phalanges. So for the carpals, okay, you can see we have the trapezium, the trapezoid, the scaphoid, the capitate, the hamate, the pisiform, the trichotrum, sorry, and the lunate right there. Okay. Now you just need to know that they are in fact carpals. You don't need to know which one is which. Okay. And then you have the metacarpals. The metacarpals are in the hand. They're covered in the skin right here. Okay. That forms the palm of your hand. And we number them 1 through 5, starting with the thumb. So over here would be 1, 2, 3, 4, 5. And then we have our phalanges, which are our fingers. And so on our thumb, which we also can call a pollex, we have a distal and a proximal. Distal, remember, is further from the attachment point. Proximal is closer. So distal, proximal. On the rest of our fingers, we have a distal, a medial, and a proximal. You can see it better over here. Distal, medial, proximal. And what can happen is that we actually form what's called the carpal tunnel there in our wrist. And so if you flip your hand over again, palms to the sky, supine, then you're going to see that we have all of these carpal bones and they form sort of a tunnel, and it's covered over by what's called the flexor retinaculum right there. And there's the nerve. Okay? And so you may have heard of carpal tunnel syndrome. Carpal tunnel syndrome can occur when that nerve gets a little bit bunched, because look at all those bones packed in there, right? And then we have all these tendons, and so that nerve can get a little bit squished. We can also get some fractures here. This is that humerus. So we can get what's called a surgical neck fracture, a transverse humeral fracture. We can get a supracondylar fracture. These are the condyles here. So supra means above, and then we can get an intercondylar fracture, which is between the condyles. Here's the pelvic girdle. In the pelvic girdle, remember that we have these hip, or the hips bones, I guess. They are formed by 3 different bones on each side that fuse together. So up here we have the ilium, we have the ischium, and we have the pubis. Ilium, ischium, pubis. And they're going to form together along with the sacrum and the coccyx to form this sort of area that we call the pelvic girdle. The pelvic girdle, let me show you this one. So here's the ilium. This purple one is the pubis, and then this orangey colored one is the ischium. That's going to be towards the back, the ischium. Okay. Right here is the acetabellum, and the acetabellum is a seat for the femur to actually sit into. So that's where the ball of your femur fits into it. So you can see how it all attaches together with these ligaments. Okay, so we have a posterior. Posterior means behind. We have the sacroiliac ligament, and it's because it goes from the sacrum up to the ilium. We have the sacrotuberous ligament, okay, because it goes from the sacrum to this tubercle down here. We have the sacrospinous because it's going to go from the sacrum to the spine, the ischial spine. Okay. And we also get, when we form our pubic bone or our pelvic bone, this pelvic girdle area, we get some different areas. We get our obturator foramen. You get our greater sciatic foramen here. These are for nerves and vessels. And we can also see that in females and males, they bind together a little bit differently. They're shaped a little bit differently. We get what's called a pelvic brim. And for females, that pelvic brim is wider and flatter. And for males, it's longer. Okay? And then we also get what's called the subpubic angle. Okay? So for females, that tends to be over 90, and for males, less than 90. Here's the femur and the patella, or the knee, right? And so there's that femur is sitting into that acetabellum in the pelvic girdle. Okay? There's that head. And off from the head is the greater trochanter. That's going to be towards the outside or the lateral end. We have the body right here and the linea aspera, which is attachment points for your muscles. There's the gluteal tuberosity to attach the gluteus muscle. And here we have the medial epicondyle and the lateral epicondyle. And just between them is where the patella is going to fit. Okay. Now this is the Q angle. And so what we can do is we can draw a straight line from the tibia up through the pelvis. And then we also draw a line out through the femur. Okay. And so this is called the Q angle. And the Q angle tends to be a lot wider, larger for females than for males. Here's the tibia and the fibula, and just like the radius and the ulna, they're actually attached together by this interosseous membrane to allow them to work as a team together. Okay. And we have the lateral condyle and the medial condyle here. And then just below the patella, you're going to find that tibial tuberosity. So you can sort of feel down this rough section on the bottom part of your knee. So you have your patella above, and then just below it, you have your tibial tuberosity. Okay. And here is the foot. And so we have all of these fun tarsal bones, which are forming the ankle. So you have your calcaneus and your talus, your navicular, your cuneiform, your medial, intermediate, and lateral cuneiforms, and your cuboid right there. And then just like in your hand, we're going to number our metatarsals 1 through 5. Okay? And we start with the big toe or the great toe. And then we have our phalanges, and in the great toe or the big toe, we have our distal and our proximal, and then on all the other ones, we have a distal, a middle, and a proximal phalange. Okay. So as you can see in this image, this is an embryo, and we've already started to develop that, I think this is 4 weeks. I think it's 4 weeks embryonic. We already start to see the development of that spine right there. And we have arm buds and leg buds right there. They're budding off already. And remember that the flat bones are being, constructed. The flat bones are through intermembranous ossification, and the rest of the bones are through using that hyaline cartilage as a layer to sort of build on top of, right? So this is called clubfoot, and babies can still be born with clubfoot now, but what happens is they used to actually break the bone and then surgically attach it back together, but now they've actually found that they can just brace it. So they will pull it back slowly and then brace it, and then usually no issues later. So you guys know where to find me if you have any questions at all.